This is Rob Kilmer. Congress is steadily moving health care reform towards the President's desk. What is it they are actually trying to get there? That's what we're going to be talking about this week on You Defend It. Welcome to You Defend It with Rob Kilmer. The phone number to call into the show is 607-772-1290. As always, callers to the show will need to take a position, be able to defend it with an argument that is factual, not emotional. And if you can't make your point without insulting someone, you can't make your point on this show. Callers and guests will be treated with complete respect. For my part, I will ask questions that matter and give people the opportunity to answer. My website is www.youdefendit.com. That's youdefendit.com. You can give me your comments on the show anytime. By Friday of each week, I will have the topic up for the next show. You can also visit my blog through the site. You can read my posts and leave your own. You can always listen to my show live on streaming audio on www.wmbf.com. And my show is then uploaded to youdefendit.com later on Saturdays, and you can listen to it from there if you missed it live. Finally, there is a new section, Debate Suggestions, on the website. It's at the top of the homepage. Leave me your thoughts on topics, debaters, and questions. Okay, what I really want to do today is go over two elements of the health care debate. The one thing that the House passed yesterday out of committee had to deal with negotiating prices with the drug companies. But the other part of it is something called single payer. And you have heard this phrase, and I wanted to go over it really in depth today so that you understand, the more you hear this phrase, what it is people are talking about. I actually have I got a caller right away here before I've gotten into anything. John,
Hello?
you there, John?
Yes. I'm driving. I live in Ithaca, but I'm driving north from the city, New York City, right now to get to go through the Binghamton area. But I was listening to Bloomberg Radio this morning, very early, obviously, and they were saying if we go to, if we even thought about a single-payer system in healthcare, which is a strange name, it doesn't really mean anything, and it's confusing to people. But
right.
If we went to that kind of a thing, we'd have, we don't want to get a system like Canada or the UK or France or Germany or Denmark or Sweden. And there's three ways to pay for. I mean, that's a ridiculous point of view, and it is propaganda from the right, and it is something we could all use.
Well, what's the propaganda from the right? That we don't want it?
Yes, the propaganda from the right is that all these systems that are used by 37 other industrialized nations in the world are bad.
Well, I mean, I don't know if you're familiar with the show, but the format is this. You got to defend what you want, not criticize what somebody else is saying. Do you know what single payer is, and do you support it?
Yeah, absolutely. I guess we're not going to get it because Congress is completely bought off by the industry, the health insurance industry. But there's three ways you can pay for an operation. For instance, let's say you have cancer, $100,000. One, if you have no insurance, you pay $100,000. I don't know who has that kind of money. Two, you have a little bit of insurance. You have insurance, a good insurance plan paid by your employers, and that pays for maybe 85% of it, so you pay $15,000.
Right.
The third way is a single payer, where everybody, 250 million people, are in the pool, and you end up paying $75, $100, $1,000 max. The problem with having the employers provide the insurance plan is that makes our industries absolutely incapable of competing around the world with the price of goods with every other country that produces goods. and services.
I agree with you 100%, and I got my answer before from somebody else, but I really don't understand why, what relationship there is between an employer and having to provide health insurance. I've never understood it, why the employer is on the hook for that, and it does. I mean, look at what's happening, or what happened with GM, and I think you're absolutely right about that.
Absolutely, and why the Democrats are incapable of bringing that argument forward is beyond me. And that's what it's turning off so many millions of voters that work so hard for this administration and this Congress to come up with a Congress and an administration that is unwilling to commit to everything that we voted for. And there's a massive amount of us that are frustrated, and I don't know where it's going to end up, but it's a big problem that we're facing. I teach at Cornell. Because of the contract that I'm on, I cannot get insurance through Cornell. I have to get it through the union that I'm a member of. That union pays for my insurance at $400 a year. It's a plan that not the union, but they collect money from the employer. But secondly, if I wanted to add my daughter, who's 10 years old, to that plan, it would cost me $12,000 a year. Any HMO or PPO that are offered by the plan.
Right. I mean, people don't talk about, and I say it whenever I talk about it on this show, nobody talks about the cost. They just talk about dividing up how to pay for it, and it's until they get to the problem of the cost, the problem itself isn't going to go away.
Absolutely. And consequently, my daughter is not covered. I live on a daily basis saying, oh, Lord, I hope nothing happens to her today. And that's wrong. That is so wrong, and it makes me personally very angry.
Well,
anyway,
listen,
thanks for listening, Ron.
No, thanks for calling, and I'm going to go over single payer right now.
Thank you, brother.
Thank you.
Care.
Bye. Okay, that is a first on this show ever, where a caller calls in before I've had a chance to read anything. I thought that was a great call. All right. What is single payer? Single payer is a term, and I took this from Physicians for a National Health Program. They have their own website, and they endorse a single payer system. And it is in and of itself, the name doesn't mean anything. So I'm going to explain it. Here we go. Single payer is a term used to describe a type of financing system. It refers to one entity acting as an administrator or the payer. In the case of healthcare, a single-payer system would be set up such that one entity, a government-run organization, would collect all healthcare fees and pay out all healthcare costs. In the current U.S. system, there are literally tens of thousands of different healthcare organizations, HMOs, billing agencies, etc. By having so many different payers of healthcare fees, there is an enormous amount of administrative waste generated in the system. Just imagine how complex billing must be in a doctor's office when each insurance company requires a different form to be completed, has its own codes, has a different billing system, different billing contacts and phone numbers. In a single-payer system, all hospitals, doctors, and other healthcare providers would bill one entity for their services. This alone reduces administrative waste greatly and saves money, which can be used to provide care and insurance to those who currently don't have it. Now, as to access and benefits, the Physicians for a National Health Program says this: all Americans would receive comprehensive medical benefits under single payer. Coverage would include all medically necessary services, including rehabilitative, long-term, and home care, mental health care, prescription drugs, medical supplies, and preventative and public health measures. Care would be based on need, not ability to pay. All right. Payment. Hospital billing would be eliminated. Instead, hospitals would receive an annual lump sum payment from the government to cover operating expenses, a, quote, global budget, end quote. A separate budget would cover such expenses as hospital expansion, the purchase of technology, marketing, etc. Doctors would have three options for payment: fee-for-service, salaried positions in hospitals, or salaried positions within group practices or HMOs. Fees would be negotiated between a representative of the fee-for-service practitioners and a state payment board. In most cases, government would serve as administrator, not employer. Financing. The program would be federally financed and administered by a single public insurer at the state or regional level. Premiums, co-payments, and deductibles would be eliminated. Employers would pay a 7% payroll tax and employees would pay 2%, essentially converting premium payments to a health care payroll tax. 90 to 95% of people would pay less overall for health care. Financing includes a $2 per pack cigarette tax. Administrative savings. The General Accounting Office projects an administrative savings of 10% through the elimination of private insurance bills and administrative waste, or $150 billion. This savings would pay for providing medical care to those currently underserved. Cost containment. The Congressional Budget Office projects that single payer would reduce the overall health cost by $225 billion, and this is how old this study was, by 2004. You can imagine that number is higher now. Despite the expansion of comprehensive care to all Americans, no other plan projects this kind of savings. Now, they give different perspectives on the benefits of single payer. I mean, if nothing else today, I want you to leave this show knowing when people talk about single payer, they're talking about government-run health care, but beyond those two terms, we don't hear anything. This is what it actually means. Okay, from the patient's perspective, each person, regardless of ability to pay, would receive high-quality, comprehensive medical care. Again, this is endorsed by the Physicians for National Health Program. This is their view, somewhat slanted. Each person, regardless of ability to pay, would receive high-quality, comprehensive health care, medical care, and the free choice of doctors and hospitals. Individuals would receive no bills, and co-payment and deductibles would be eliminated. Most people would pay less overall for health care than they pay now. Doctors' incomes would change little, though the disparity in income between specialties would shrink. The need for a wallet biopsy before treatment would be eliminated. Time currently wasted on administrative duties could be channeled into providing care, and clinical decisions would no longer be dictated by insurance company policy. Medical endorsements include Physicians for National Health Program, obviously 9,000 members, American Public Health Association, 30,000 members, and there's a list there. Several different, maybe 10, 15 more organizations. They don't really tell you how many people are involved. I do not see the American Medical Association among them. Okay. Hospitals. The massive number of administrative personnel needed to handle itemized billing to 1,500 private insurance companies would no longer be needed. A negotiated global budget would cover operating expenses. Budgets for capital would be allocated separately based on healthcare priorities. Hospitals would no longer close because of unpaid bills. And finally, the last three categories. Insurance industry. The need for private insurance would be eliminated. One single payer bill previously proposed in the House would provide 1% of funding for retraining displaced insurance workers. Business. In general, businesses would see single payer limit their health costs and remove the burden of administering health insurance for their employees. And finally, Congress. Single payer would be the simplest and most efficient health care plan that Congress could implement. Again, this is the perspective of the Physicians for National Health Program, but at a minimum, at least it explains what the terms mean and how in general it would work. So now going forward, you'll know when somebody talks about single payer, they don't mean the single payer is the government and that they are the payer of all medical expenses. The revenue they get to make the payments comes from taxes, 2% on the employee, 7% employer. From that money, they pay all medical costs. No more bills, no more billing within the hospitals. That's the argument in favor of single payer and an explanation of single payer. All right, it's run a little long here. We're going to take a break. When we come back, I'm going to ask you to think about some questions, like that caller said. The reaction is to say, we don't want it to be like Canada. We don't want it to be like these other countries. And I've talked about that and said, why not? Other than calling it socialism, you're going to have to give me a little more. When I'm looking at real costs, characterizations won't cut it. Okay, we will be right back. You are listening to You Defend It with Rob Kilmer right here on News Radio 1290 WMBF Binghamton. Welcome back to You Defend It with Rob Kilmer. I want to go over a few quick things before we take our 8:30 break. All right, we got done talking a few minutes ago about the single-payer system and what it means. And that means that's as close to government-run health care as there is, where the government pays all the bills. You pay into the government takes care of the rest. Now, these are my questions. And again, the premise behind You Defend It is it's not enough to simply criticize. You got to come up with an alternative that works. And we've been talking about Canada, long waits for certain types of surgery, without anybody saying, my alternative is this. My personal opinion is perhaps we can take Canada's system and improve it. I don't know. Nobody's talking about it, but they don't seem to have the ruinous effects on industry that we do in Canada. But take, for instance, Medicare. That's government-run health care, pure and simple. Takes in tax revenue, pays the bills. Has Medicare failed? I've never heard anybody say that. Has Medicare failed? Do you think the AARP would support repealing Medicare? I don't think it would. And I don't ever hear anybody talking about repealing it. And at least from what I've heard, from the people who are characterizing certain aspects of Obama's plan or previous attempts to reform our healthcare system as socialized medicine, Medicare is socialized medicine. So what's the problem with it? That's the natural question. What's the issue? Where did we go wrong on Medicare? Is it possible that it works? The second question I have, what real alternatives are being offered? You may have heard in the news intro between 8 o'clock this morning and 8:06 that I think it was John Thune, a Republican, talking about adding bureaucracies, adding layers of the... What's his plan? What is the Republican alternative? I've never heard it. I hear things like tax credits. Tax credits means you get credits. You get to deduct from your taxes the amounts that you pay for health insurance. If you don't have the money in the first place, tax credits don't mean a whole lot. They don't solve a problem. Plus, simply saying, well, whatever you end up paying for health care, we'll give you in the form of tax credits, or we'll give you tax credits if you buy a certain policy, it doesn't do anything to address the cost. Nothing. Not one thing. It's the cost. It isn't health insurance that drove GM to where it is. It's the cost of it. It wasn't simply the fact that they were administering a program. It was the fact that the program was unsustainable. And that caller earlier today was right. It makes us unable to compete worldwide when we got to add this peripheral factor of providing health insurance for our employees into the cost of producing goods. Where's the alternative? And last, again, I mean, I talk about it every week that we talk about this. Where is the effort to control the cost? Still, at this late stage, almost no discussion of it. Only what we're really discussing is how to divide up paying for it. The $300 apple. Nobody says, why does that thing cost $300? They say, well, who's going to pay for it? Let's divide it up this way. We'll have the employer pay this much and the employee will pay this much. I mean, it's madness. And unless and until we get to a reasonable reform, we are not going to have a competitive business environment. We can't. We keep saddling employers with these obscene medical costs. Again, I just don't see it. And I now understand, I believe it was Lucas who called in and explained how it became their responsibility. I have the word responsibility in quotes, in the first place, but that doesn't make it right. And I don't understand the connection between the two. I do not. Why your employer should have to pay for your health insurance, why not make them pay for your kids' education? Okay, we're going to take a break here at 8:30. I know I got a couple callers, but I'm not going to be able to get to them until after the break. We'll take a break here at 8:30 for local news and be back right after that. You're listening to You Defend It with Rob Kilmer right here on News Radio 1290 WMBF Binghamton. Welcome back to You Defend It with Rob Kilmer. The phone number to call into the show is 607-772-1290. Got a couple callers. I'm going to try and get to one right now. I believe that is Nettie from Endwell. You there?
Yes, I am.
Welcome to the show.
Thank you. I'd like to talk about Medicare.
Okay.
I have belonged to Medicare, and now I belong to a Medicare Advantage program.
And what's the difference?
What's the difference? Well, there isn't a whole lot of difference. The Medicare Advantage does cover more things than Medicare does.
Okay. Does that cost you money?
Oh, it does. Absolutely. And you also, with this Medicare Advantage plan, you have to stay in network.
Oh, okay.
But my problem with Medicare, I know you mentioned that you hadn't heard anybody having any problems with Medicare. And they tell you what you can have and what you can't to a certain extent.
Okay.
And an example is Pap smears for ladies. You can only have those every other year unless there is some questionable problem.
Okay.
But on the other hand, they pay for Viagra for men. Now, this seems wrong to me.
Huh. Not quite sure how to approach that. Well, I think you should write a letter.
I have been to Social Security. I have, but who should I write the letter to?
Your congressman.
I have done that too.
On Viagra?
Not necessarily on Viagra. I guess I haven't written about these things. What I have written about is my next problem.
I'm almost afraid to ask. What is it?
Well, the way they charge for Medicare B is it's very unfair.
How so?
Normally, they charge, most people pay $96 a month for Medicare B. I am paying $250 a month, and only because, and the reason they do charge according to your income.
Okay.
But if some year you sell stock because you need the money, then for 2 years they charge you according to that year's income.
Right.
So I have been to the Social Security about that, and I've been to, I've talked to so many people about that, and they say, well, they only change your fee every 2 years, which is not true, because last year I paid $199.
$199 what? For how? For
Medicare B.
Per month?
Yes.
Do you think that you would, and did that include the Advantage?
No.
Do you think that just what you're paying in Medicare, or for Medicare, do you think you could do better with private insurance?
I don't believe so, no.
Okay. I mean, have you considered, seriously considered, dropping Medicare?
Well, like I say, I'm really not on Medicare right now. I'm on Medicare Advantage.
Okay. And I'm not actually sure after a certain point if Medicare can be dropped. But I got 2 more callers I want to get to. But I appreciate the call.
Well, thank you for listening.
Thanks very much.
Okay. Bye.
Bye. Okay. Paul from Vestal, you there?
Good morning. How you doing?
Good. How are you?
Good. Say, how about this? Not having insurance is a huge problem. Why not, or why can't we expand the Medicaid rolls to get the uninsured in so that they have some kind of insurance for everybody? And then you just have to set up some kind of a wage scale as to deduction, et cetera, et cetera.
Is that not single payer to some extent, where you take tax money?
No, but what happens is that once you reach a certain income, you don't qualify for Medicaid.
Right.
But
you're saying expand the income, and a sliding scale, so to speak?
Exactly. And now you got to get the physicians on board. Any physician who is not going to accept Medicaid, you're not practicing. Everybody's got to be on board. And then you got to work out some kind of a deal where, look, if you're going to med school, we'll either forgive a portion or all of your loans, but you're going to have to give us something back in service to, working in a health clinic, so that you can take care of that piece.
Well, I wouldn't be surprised if those programs aren't offered right now. I mean, it seems like every president offers something along those lines.
But you don't have to. If you're a physician, you don't have to take Medicaid. I don't honor it.
Right. That's true. Well, I mean, that's a reasonable idea, and we're going to have to do something. I mean, at least Congress is talking about it now. But
and that's the thing. All those physicians, they got to get on board. And if you're not going to take Medicaid, then you're not practicing.
Well, I don't know. I mean, just from a legal standpoint, I would question whether or not you could tell a physician that he or she could not practice if they were not willing to work for a certain amount. But certainly, the way you remedy that is to come up with a reasonable scale of payment. And if, in theory, you are able to eliminate so many of the administrative costs that there are in existence right now, if you go to something like a single-payer method, then perhaps there's more money available for that to pay the doctors.
That's what I think we're all hoping for. But there's got to be something done, because
it's killing us.
You have to have medical care.
Right.
Yeah.
And nobody can afford it. Okay, thanks very much for the call. I'm going to try and get to one more here. Okay, I have a call from Nichols. Are you there?
Yes.
Can you give me your name, please? I can't.
Ladd.
Welcome to the show.
Hi. When you said that Medicare takes in the money and pays the bills, that's really not right. Medicare reimburses doctors and hospitals so poorly, as does Medicaid, that the costs are shifted to the private insurance because Medicare and Medicaid set how much they're going to pay doctors and hospitals, and the private insurers have to negotiate. So there's been an ever-increasing cost shifting to private insurance, which effectively subsidizes Medicare and Medicaid.
Right, they make up the difference.
Right.
My point was that from an administrative standpoint, Medicare takes in the money through taxes and pays out to the providers.
Right, but
you're saying that they don't pay the full shot.
So that if we get rid of private insurance, then there's nobody to cost shift to, and so that the end result is almost certainly going to be rationing. And there's another thing you read in the description.
What is rationing? You know what? That's a term that we also hear.
I'll explain it through what I was just going to say.
Okay.
You also said that this one group describing single payer was going to stop hospital billing and pay them a lump sum in a given year.
Right.
Now, if they pay them a lump sum, just think about it, and they don't know how expensive the services the hospital are going to provide in that year, how many cancers they're going to get, how many very chronic conditions they're going to get, how many preemie babies, 2-pound babies they're going to get ahead of time. But they're going to give them a lump sum to payment. That means that the hospital has to live with that amount of money, so that in the end, when they get to where their fiscal year is ending and they're out of money, they have to cut costs somehow, and that's by delay. And
are you saying that
that kind of delay will amount to rationing? And it's the same thing if you go to a capitation system where the doctors, which is what they're talking about, where the doctors get paid instead of getting paid for service, they get paid so much per head per year, so that again they have patients who on average are sicker in a given year. The only way for them to stay alive is to say, well, I can't see you I can't see you in 2 weeks. I have to see you in 6 weeks.
But I want to get back to this rationing. Are you saying that rationing is that when, like for instance, with this global budget that these physicians talked about, that they endorsed, this Physicians for a National Health Program.
Right.
Global budget means, say, Lourdes Hospital gets, and this is just a number that is meaningless other than for this conversation. They get $1 billion.
Right.
They have to decide where to spend it.
Right.
As far as the patients are concerned.
Exactly.
Is that what you mean by rationing?
And they can't. Right. It's not an evil thing. It's going to be the end result of having a lump sum when you can't predict how sick your people are going to be.
Okay.
You can't predict how if a new technology comes out that's going to cure a cancer instead of just result in palliative care and send them along to the heavenly gates. You can't predict these things ahead of time. The main point was the cost shifting. The idea that Medicare pays for itself. So why don't we have everybody in a system that pays for itself? It's not true.
Well, I didn't mean to imply that Medicare pays for itself. My point was this. There's never a call to repeal Medicare.
No.
Medicare is as close to socialized medicine as anything that the people who are currently complaining about, what's being proposed in Washington. It's socialized medicine.
And I agree with that, but the idea that it's not broken is wrong, because it's only viable because of shifting the cost to other people, which is why other people's private and people who aren't on Medicare, their private insurance costs so much. It's not greed. It is largely a result of this cost shifting.
You're saying it's because of the underpayments by Medicare
and Medicaid.
And the insurance industry is having to pick up the difference.
And I'm glad you said and I'm glad you said Medicaid, because that's the reason why many doctors won't take Medicaid patients. Isn't that they hate poor people? It's that the reimbursements are a half to a third of what private insurance is, and they just can't survive on these payments.
And that's an interesting, an important point you make. And to me, like every other issue, we've turned it into what it's not. This issue with health insurance in this country is a mathematical issue. That's what it is.
Right,
it is not a discrimination issue. It is not a moral issue. It is a mathematical issue.
Right, which brings me to the most important point, is what's wrong with the government in general, Medicare, Medicaid, everything. And if you go to single payer and don't fix this first, it just exacerbates everything. And that is, government must be required to use normal accounting procedures, normal accounting systems. The federal government has 500 different accounting systems in 500 different programs, and that can never be traced. If a private industry ran their accounting, their books, the way the federal government does, they would all be in prison.
And some of them are. Okay, well, thanks very much for the call.
Thank you.
I really do appreciate you calling in.
Bye.
Okay, we're going to take another break here, then we'll be right back. And I want to talk to you about an article on CNN Online this morning. That'll probably take us to the end of the show. You are listening to You Defend It with Rob Kilmer right here on News Radio 1290 WMBF, Binghamton. Okay, welcome back to You Defend It with Rob Kilmer. I do not know, I got one phone call there. I don't know if I will get to it by the end. I want to read an article from CNN. This happened yesterday. The article is dated July 31st. Democrats in the U.S. House of Representatives said Friday they would push for government power to bargain with manufacturers for better drug prices for the Medicare program. If successful, they would reverse a 2003 ban on such negotiations and require the Department of Health and Human Services Secretary to negotiate with manufacturers for the program's drug benefit. Representative Peter Welch, a Vermont Democrat who put forth the proposal, said it would allow the government to leverage the millions of Americans enrolled in Medicare drug plans and save money. Quote, this is a common-sense way to use government's purchasing power to save seniors and taxpayers money on prescription drugs, end quote, Welch said earlier this week. Representatives from the Pharmaceutical Research and Manufacturers of America, which represents drug makers, had no comment. The ban against price discussions was implemented when the then Republican-led Congress passed the Medicare drug benefit in 2003, allowing private insurance companies to offer drug coverage under government oversight. Democrats decried the action as a giveaway to the drug industry and have been fighting since to change it. About 25 million of Medicare's more than 45 million beneficiaries have opted for the voluntary Medicare Part D, according to the Centers for Medicare and Medicaid Services, which runs the insurance program. Representative Jane Harman, a California Democrat on the House Energy and Commerce Committee, which is finalizing a health care reform bill, told reporters during a committee break that she would raise the possibility of allowing U.S. consumers to import cheaper drugs from other countries, but may not push for a vote. Okay, that's the end of the article. I read the whole article to you. Sometimes I don't ordinarily do that. I'll take things out of articles, that are just so I'm not reading the entire show. But here's my question. And to me, this seems somewhat glaring. I actually have two questions. Where are the people out there articulating an argument in support of the current system, of not allowing negotiations, not allowing the government, with the millions of people it represents, customers in this sense, not allowing negotiations to reduce the price? And secondly, more importantly, what is the benefit? to not negotiating. I mean, it seems to me that the same people who are screaming socialized medicine, are eerily silent on this issue. They're willing to allow what is supposed to be capitalism to be garaged for this issue. You know, capitalism. I mean, is this not a hallmark of capitalism? That negotiating prices based on bulk, based on your the number of people you are obtaining a product for, don't you get a discount for that? You mean to tell me a school buying a desk pays the same amount for that desk as it does if it buys 5,000? That's capitalism. And the very same people who are screaming about socialized medicine right now support capitalism being ignored and taxpayer obligations being increased on this issue. I don't want to call it a giveaway to big industry, but I got to tell you, it's hard to figure out what the motivation is there. It seems like the people who hate socialism disdain capitalism in this regard when it comes to negotiating based on bulk purchase. How can that not be? How can that be anything other than classic capitalism? The more you buy, the less you pay. Discounting. I have yet to hear anybody articulate an argument in support of that. That the government should not be allowed to take advantage of the same characteristic of capitalism that everybody else can and negotiate lower prices for bulk purchases. You know, we're losing the helicopter, we may or we may not, because of cost overruns and other things in Owego. And by the way, like everything else, when you look into those cost overruns, a lot of those were situations where the government changed its requirements midway through the project, but that's another story. I don't get into the local stuff. But if anybody can explain to me the rationale behind the largest purchaser of an item not being allowed to negotiate its price, I'd love to hear it. I've never heard it, and I would like to hear it. And to pass that into law, I mean, that is an amazing thing. Okay. Got time, I think, for one more. Rex from Binghamton, you there?
Yes.
Welcome.
Thanks. I don't even know where to start. The lady you were speaking with a little while ago, you asked her a question if she paid anything for it, and she said no. Well, you know, the money doesn't just materialize out of thin air.
I think she said $199 a month.
Well, no, but earlier you asked her, she said something, and she said no. You said, do you pay anything for it? She said no. But
okay.
Regardless, of the G8 countries, what right now, this is a question to you, do you know which country is in the best shape economically?
No.
It's Canada. Just because Canada has huge regulation. I mean, the whole free fall thing that's happening with like our mortgage industry right now didn't happen to them because they are very regulated.
And do you support that?
The regulation, yeah.
Okay.
In a way. But my bottom line point is Canada is going broke on their health care. They are the most fiscally responsible country around, and they can't pay for it.
Well, I would say, as I say on the issue of American health care, what's the problem in Canada? Is it cost?
Yeah, it's cost. Well, Medicare is going broke. When you started off the program, you talked about Medicare, and you said, does anybody complain about Medicare? Medicare is going to be broke within, 7 or 8 years going to go broke. How is adding another 50 million people to it or more going to make it solvent?
Well, because Medicare is only one part of the picture here. To me, the cost of health care extends into many different aspects of our economy, and we have car manufacturers going broke over health care. What does one have to do with the other, other than they're mandated to pay for it? We've got to find a way to reduce the costs, and until somebody starts with that premise that the only way you can reform health care is to begin by reducing costs and not move on to the next step until you've done it, then it's just a matter of 50 people sitting around trying to figure out how to divide up the cost of something that costs too much.
Right, and I agree with that in many ways. And my solution, you say you want somebody to have a solution.
I do.
Here's my solution. I mean, the government doesn't pay for your house insurance. It doesn't pay for your car insurance. In the 1950s, before the government ever got involved in any of this stuff, nobody complained about health care insurance. People had insurance for catastrophic needs. If you had something that, you went down, I got checkups when I was a little kid. My mom paid for it, wrote a check. But then my father had ended up with non-Hodgkin's lymphoma, which ultimately killed him. Our insurance paid for that. We had catastrophic health care insurance.
So you're saying for catastrophic issues, but for nothing else?
Yeah. Well, when the government first started getting involved in health care was in the 60s.
I got about 30 seconds left.
It has steadily gone downhill since the government's been involved in it.
Okay.
I don't see how getting the government even more involved is going to fix the problem.
Well, thanks very much for calling in.
All right, thanks.
Yep. Okay. That's going to do it for this week. We will be back next week. Maybe we'll be talking about health care. Maybe Congress will have moved on a little more, but they're in recess right now. Thanks for listening. And to you, Defend It, on News Radio 1290, WMBF Binghamton, and we will see you next week.